Welcome to today's press briefing. We have with us from the Center for Health Protection, Head of Communicable Disease Branch, Dr. Chang Shuk-kwan, and from Hospital Authority Chief Manager, Dr. Lau Ka-hin. We'll first hear from Dr. Shang. Good afternoon, everyone. I wish you all a healthy and prosperous Year of the Tiger. Yesterday, we have had 129 cases. Cases number 14204 to 14332, 27 cases are imported cases, 102 cases are local infected cases. Of the 102 cases, 9 of them carry L452R, that is, suspected Delta variant. Most of them are living in Choi Wan Estate, and 1 or 2 of them are currently unlinked. 81 cases are N501Y. That's the majority of the cases. Most of them are other cases. There are also 12 cases that are still being investigated into. They might be of a very low viral load, or genome sequencing analysis is still underway. Of the 102 cases, 80 of them are related to other cases. 22 cases are currently unlinked. Of the unlinked cases, for Omicron, suspected Omicron cases, they live in Yuk Ming Court, Sai Ying Pun, but works in Lai Chi Kok. In Tong Wan House, Tai Ang Tong Estate, 2 units. They are currently not related because they are on different floors in different blocks. One lives in Inon Street, number 28, To Kwa Wan, and Shang Hung Road 15 in Zhong Lam Dai Ha. There is also Hong Hum Si Jing Dai Ha, Wu Hu Street, Yu Shan Street, Lai Choi Court, Lai Tong House, Block 3. Nam Sheng Street, 137 to 139 Sham Shui Po, Riviera Garden in Chuen Wan, Shek Lei Estate 2, Shek Yam Estate East, Yam Yu House, but not 0607. I was talking about Shek Wan House in Shek Lei Estate 2, Yu Ping House in Long Ping Estate. There are some cases in Long Bun Oasis at Block 7, also Affluent Garden, South Tai Estate, South Tai House, and another public housing estate in Sha Tin. There is 1 case in Tai Po, Mason Building. There are 2 cases, different orientation, different blocks. Suspected Delta cases, Choi Wa House, Tai Wa Estate, but not the flat in the vertical transmission. Someone working in Lam Tin, suspected to be infected there. Someone who lives in Kwai Tong House in Yau Tong, working in Taiwan. For previous genome sequencing analysis cases, there are 2 people who work at the airport, 14013 Well, in relation to a flight arriving on the 25th of January with a group of infected cases, there is a chance that they were infected from that group. Yes, last night there was also some evacuation, vertical ones and lateral ones. For Ming Lai House, apart from units 16 and 17, we also see some units, 3 of them in Unit 16 that are affected. There was 116 flat in the 10th, on the 10th floor. There are altogether 4 such units. We will move units 16 as well. In Taiwan Estate Choi Wa House, Unit 25 and 26, there are some cases, 2 units respectively, And for Unit 25 is the 23rd floor, and Unit 26 above 22nd floor. We'll now hear from Dr. Lau. Today is the Chinese New Year Fest Day. I wish you all healthy New Year. As at 9 a.m. in the previous 24 hours, the HA system has recorded 129 reported cases. In the previous 24 hours, another 26 patients have been discharged. Altogether, 12,806 patients have recovered and been discharged. 1,103 COVID patients are staying in the community treatment facilities at the AWE, the North Lantau Hospital, Hong Kong Infection Control Center, as well as 13 public hospitals. They're all in a stable condition. There is a case about an administrative assistant in Yan Chai Hospital. There is someone who works in orthopedic rehabilitation center who was tested positive on the 29th of January. That staff member currently works at the North Lantau Hospital, Hong Kong Infection Control Center being treated. That person's in a stable condition. Last workday is the 28th of January. The person's mainly in charge of clerical work in the orthopedics rehabilitation unit. That person doesn't come into contact with patients and has always been wearing personal protective equipment. We've started tracing and found that there is one patient care assistant who had a meal with that patient on the 26th of January. That patient care assistant is now classified as a close contact, will have to be put under observation. Currently, the test result of the care assistant is still negative. The relevant ward has been thoroughly disinfected. The hospital will closely monitor the health condition of patients. Now the floor will open for questions. Please use the microphone we give you before you start. Introduce your media organization. I'm from RTHK. I'd like to ask the HA. Professor David Hui said that for AWE there are 1,000 beds, so there is still spare capacity. However, if there is an increasing number of cases, then they need to change the discharge arrangements. Say, for example, for CT value above 33, for consecutive three results of such level, then they can be moved out. Why would there be such a change? What are the differences? If there is a new arrangement, when will it be effective? If there is still a high, even though there is a high CT value, is there still any risk? Do they have to be isolated? Do they have to be tested and isolated? In relation to discharge conditions, we've been talking to experts. Of course, we'll monitor the situation and update guidelines. You all know about the current situation. We have an increasing number of cases. In relation to discharge criteria, we are in active discussion. When the time comes, we will make an announcement. When the clinical condition of patients meet the requirements, the CHP will lift the isolation order. If the clinical condition of the patient is favorable, they will be discharged. In relation to the CT value, we've been cooperating with the Hong Kong U. We send samples of patients to the Hong Kong U for a viral culture. We know that if the CT value is above a certain level, there can't be, viral culture can't be done. We have forwarded the information to the Scientific Advisory Committee for their advice to see if we need to update our discharge criteria. We'll follow the recommendation of the Scientific Advisory Committee or the CHP.
Next question. Good afternoon. I'm from Now TV. About Tung Mun House and Mason Building, we see new cases now. Has it to do with the outbreaks previously happened in these two buildings, or is it for the time being the source of infection is still unknown? About Kwai Chung Estate, we see some buildings having infected cases not identified at the quarantine center. May I know what units in which buildings are newly infected? And can you comment on Kwai Chung Estate's situation? Is it that the transmission link has been cut, or should we be concerned still? Another question, there are cases strewn in various districts. Now, are there any cases involving Lunar New Year dinner gatherings? Finally, for the person working in Delta who is suspected to carry Delta strain living in Choi Wah House, may I know his occupation, and did he get infected in Lam Tin? For Tong Mun House and Mason Building, well, the cases emerged quite some time apart from previous cases. For earlier cases, they had to do with imported cases, so I suppose there is no linkage. But still, there are cases of this nature in the community, so we will continue to monitor the situation. For Kwai Chung Estate, there are indeed new cases. Earlier, after we put an end to the RTD operation, we left behind specimen bottles for self-testing. In Yat Kwai House, there are 2 more cases, and Ying Kwai, 1 more case. And there are also cases in other districts as well. So in terms of RTD operation, we have successfully identified cases, but it is still within our expectation to see more cases to come up. It is therefore acceptable because it is not a major outbreak. Choi Wah House. Well, we've noticed the Omicron strain in some cases in Tai Po district, and that there is another case of suspected Delta. In Wong Tai Sin and Yau Tong, there are also suspected Delta variant cases. So we suspect the source of infection to be in Lam Tin, because we see some cases in Chung Kwan O as well. The speaker's not coming through. I don't think I'll go through the occupation of each and every case. They come from all walks of life. Next question, I'm from Hong Kong 01. 14013 and 13945. These are 2 workers at the airport. You just mentioned that they might have got infected during work at the airport. May I know the details? And we have many untraceable cases today. May I know altogether the number of untraceable cases that remain untraceable at the moment? Now, for case details, first, for the 2 cases, Delta cases, was there any high-risk exposure, or did they go to crowded places? For the 2 airport workers, they did come into contact with arrivals at the airport because of the test and hold arrangements. Some passengers might go to the toilet meanwhile, and 1 worker was responsible for cleaning the toilet, the other was responsible for maintaining order. Although they had the full PPE on, in those 2 days, there were many cases coming to Hong Kong via the same flight. So the viral load would be very high. And if you were not careful when you during degowning, you might get infected. It's very difficult to trace which step along the way did they get infected. For untraceable cases, starting from 12872, at the moment we still have 98 untraceable cases. We have successfully eliminated some untraceable cases and found linkages. As for the 2 Delta cases, I'm not going to disclose the details of their movement records. There is nothing in particular. I would just say that Omicron is the main mutant strain in Hong Kong, whereas for Delta cases, they're mostly situated in Wong Tai Sin and some sort of spreading in Kowloon East. Next question.
Questions from the South China Morning Post. Firstly, there are 22 untraceable cases today. Is that the highest number of untraceable cases recorded in the fifth wave so far? And does that mean that authorities are having some difficulty in finding out the sources? Is it a controllable situation at the moment? And can you please comment a little bit about the situation in Kwai Chung Estate after the lockdowns, and it's also the festive period right now? Will there be a lot of more emerging cases coming from this? And would you describe that the situation there is already contained?
I think the number of 22 unlinked cases is the highest so far since the fifth wave. And unlinked cases indicate that there are a lot of other cases in the community that are unknown to us at the moment, so that we cannot find the linkage between the cases with those that have been detected so far. Of course, with more cases more people going testing and more history, we may find some cases to be linked to other cases subsequently. But the large number of unlinked cases in the community still indicates there is quite some community transmission in those areas. And for the Kwai Chung Estate, we do find one or two cases in those buildings that have been under 5-day RTD, and we expected there may be sporadic cases in those buildings and nearby buildings because we have quite some community transmission in those areas. So once they get out to the community, they may use some common facilities nearby and maybe get infected. So those cases were detected through the testing. We give them for the bottles after they leave the building. It's also under compulsory testing.
Next question.
I think the major outbreak in those 2 or 3 buildings have been largely brought down by the RTD, but we expect there are still some community cases in the community from various districts. Yeah.
Next. No other questions? That's the end of today's press briefing. Thank you. Preliminary positive cases, some 90 cases.